and now are ready for the afternoon session. So thank you. I am honored to welcome my wonderful first guest of the afternoon, Professor Franco Bassetto.
Hi, Jessica.
Hello, it's my pleasure, and welcome, and have a seat.
Thank you.
You're so welcome. And I would love for you to introduce yourself.
Yes, thank you for your kind invitation. I'm president of Italian Society of Plastic Surgery, and it's the society in which 1,600 certified plastic surgeons are working in our country. And obviously, this society covers the three aspects of plastic surgery: reconstructive surgery, regenerative surgery, that nowadays is actually in the future, and cosmetic also. So for me, it's really a pleasure to represent these surgeons in this moment in which plastic surgery had exploded and is requested in reconstructive surgery by all the specialties, because the plastic surgeon arrived to reconstruct, arrived to regenerate tissue that are destroyed from a trauma, from a burns, from a tumor, and so on. We work with all the specialty, like complementary specialization. On the other hand, we have the explosion of cosmetic surgery, that it's related to the time that we are living, and the new concept of wellness, in which cosmetic surgery is a possibility to reach it in obviously a safe way.
Grazie mille, and truly, Professor Bassetto, it's an honor to have you here at Scientia Vitalis, so thank you. Facial, plastic, and aesthetic surgery is one of the most complex and rapidly evolving areas of modern medicine, where innovation, surgical expertise, patient expectations, and safety must coexist in perfect balance. Within your lecture and your expertise, you explore three fundamental pillars that are shaping the future of this discipline, which are safety, innovation, and the prevention of complications. It is a privilege to have the opportunity to discuss these topics with one of the leading international experts in the field. Professor Bassetto, when we speak about excellence in facial, plastic, and aesthetic surgery today, what should come first? Aesthetic outcome, patient safety, or the preservation of patients' facial identity?
Thank you for your first question. Yes, I'm a little bit tired because I'm coming from Bucharest, in which we have an international meeting discussing about the same topics.
No problem.
I wrote, when I accepted your nice invitation, and I saw that excellence would be one of the main topics, I thought that what is very important nowadays is to define what aesthetic surgery is. So I think that aesthetic must now be recognized as the anatomical modification of recognized defects, but with respect of symmetry, proportions, aesthetic facial units, that it's something that is extremely technical, because on the face we have different parts that are called aesthetics units that need different approach, obviously in a universal and geographical area idea of beauty. For example, in Japan, we know that the patients asking to have the internal canthus more narrow to the nose. Exactly. In Italy, sometimes we have young girls that ask for fox eyes, that ask to move the external canthus. So the expert plastic surgeon must be extremely clear with the patients, try to go on in the consultation to put the improvement that the cosmetic surgery can give must be in line with symmetry, with beauty, with anatomy, and with geographical findings of the area in which the patient is living, especially in this moment in which we have a lot of confusion and movement between populations.
Exactly. Keeping ethnicity in mind is of the utmost importance. And another priority of yours is safety, yes? So from your experience, what are the most important factors that contribute to achieving a safe, reliable, and predictable outcome in facial surgery?
Oh, you have to consider that plastic surgery is working in all our body because there are parts of plastic surgery that take care of hair transplant and other plastic surgeons that are doing orthoplastic surgery for saving legs after a trauma. So safety, what is safety? The safety in plastic surgery that now it's fundamental, and we are working as national recognized society by the Ministry of Health, but we are also working all over the world. I am part of the G7 of plastic surgery, that it's the group of the most important 7 societies in the world. And we had this year 2 meetings in which we discussed the same problems from Argentina to Italy, from United Kingdom to USA to Brazil, Japan and India. So I think that we must in this moment assure safety to our patients. But there is a simple rule that you have to follow. When you are thinking to a procedure of cosmetic surgery, it's very important the choice of the surgeon that must be a certified and expert surgeon in an equipped setting. This is very important. Unfortunately, or fortunately, we are working a lot with the Minister of Health in Italy, try to assure to the patients that only certified surgeons must perform such kind of surgery. And this was opened by, unfortunately, deaths. Deaths that we had in Italy from patients that unfortunately were operated in not sure settings, in apartments where the anesthesiologist was not admitted for economic saving or so on. So I think that a patient, when think to a cosmetic procedure for hair or a male, now we have a lot of male that are asking cosmetic surgery, it's important to speak with the partner, a son with the family, a daughter with the mother, and then also with the JPs. Because the JPs is the only doctor that do your interest. And it's the only doctor that it's not influenced by web, by economical interests. And that can suggest to you that is a good certified surgeon. I know his career, I know its value, and he's working in an equipped. When there was the last death that was in Rome some months ago, immediately La Repubblica called me saying, "Oh, Professor, but do you see emergency in your operating room?" I saw every day. Every day we have emergency, but we have one anesthesiologist in one operating room and another in another that immediately come and transform in emergency in a normal solution. So this is safety.
The work you're doing is so important. Thank you. Innovation is continuously transforming medicine. Among the many technologies and scientific advances available today, which innovations do you believe are truly changing clinical practice and improving outcomes in facial plastic and aesthetic surgery?
Oh, I think that we are lucky because now we are living in a very advanced technologies society. And so, sure, it's in front of every operation, it's important and anatomically planning in details, because as I told to my patients, we are not Michelangelo. We are not working with the stones. We are working on human tissues that will have inflammation, retraction, and some phenomenon that it's not easy to prevent. So it's very important and anatomically planning in details. What we are doing now as our generation, and what we are also teaching to our residents, try to help them to become good plastic surgeons, is try to do this anatomically planning also with helping tools that now we have, algorithms or something that the web, if you use it in a proper way, can help. The other very important thing is the anesthesiologist control approach. Every time that we use a drug, we can have an accident. We can have something that happened without our knowing. And so it's very important to collaborate with another doctor that is with you to resolve an emergency in a normal situation. That I wrote something in the plane coming here. And so the other things that is very important, don't use new tools if you don't have enough experience. The technologies are running very fast. And so when we have new devices, we must be experienced with them. It's not useful to do something that you see on the web that somebody else do. It's important to perform them, for example, in the cadaver labs. Now we have many opportunities of cadaver labs. Also in Italy, fortunately, we have cadaver labs in Padova, in Verona, in Milan, in many different anatomical sites when you can try in collaboration with companies new tools. And it's very important, for example, I'm sure for the nowadays and for the next future to use new tools like endosutures that can help to have more stable results. And then specific surgical instruments. We can't do anything with knives and with a scalpel like 50 years ago. Now we have very, very specific instruments for every operation. And so this is very important for the precision that we want to reach. Then I wrote, for example, the use of local echography. The future, but now also in many clinics like mine in Padova, now we have many very small echography that permit to you the subcutaneous tissue, the relationship between the adipose tissue and the muscle in which you have to operate. And so you can prevent when your scalpel and where your scalpel is going on, and this is very fantastic. The other things in cosmetic surgery, like for example lifting, the possibility to low and control temperature dissection. This is another modern technology that is very important, because in the past we use a lot of technologies at high temperature that gave burns of the tissues, inflammation, and complication. Now we have these that I think will be the future, and obviously we have also now hyper potential lights that permit to have a better view of the operating site where you are working, and loops, I use loops also to remove a nevus. And my residents say, "Oh, professor, why do you use loops for a nevus?" Because this gives me a perfect approach. I see the lines for having the best evolution of the scar. Because if I put the incision of the natural lines of the face, you don't will see anything after 6 months. And so this is another opportunity.
Thank you so much. And your priority is prevention rather than management of complications. Professor, do you believe that modern facial surgery is increasingly focused on preventing complications through planning, patient selection, surgical strategy, rather than simply managing them when they occur?
Yes.
Of course.
You put your finger exactly in the point that are common to all the world. This is exactly what we discuss in the plastic surgery G7 societies. Yes, this is right, because we have to select different techniques and technologies for every predictable and clear result. We can't obtain anything with everything that you have in your operating room. You need to have specific instrument, you have to know specific techniques, and this is a little bit complicated. So you need experience. It's very, very important to grow up and ameliorate your experience with a great mentor and experienced plastic surgeons that can help you to be sure of your capacity to solve problems. But also remember that it's very important to have experienced strategy also to resolve complications, because they happens. So if you had the possibility to grow up in a residency course, and then to follow a mentor, and then to participate to important cadaver lab with good teachers and mentors, maybe you will see a lot of complications. This is exactly what I say to my residents. It's important that you understand also to resolve a complication in a burned patient. Maybe in your life you will be only blepharoplasty or lifting, but if you know what happened when you burn a tissue, maybe if you burn a skin during a lifting, you don't have problem to solve this complication. You know what to do, and this is experience. So I recommend to younger generation, don't be hurry. Don't try to do too much before to be experienced. And if you want to earn money, because cosmetic surgery is not in the level of assistance of national insurance. So it's something that people ask and people must pay, because national insurance can give reconstructive surgery, but not cosmetic surgery. If you will grow up slowly, you will become, I hope for you, a good plastic surgeon that can buy that car, or also a Lamborghini. Why not?
Exactly.
Why not?
But it's imperative that you're prepared for the worst possible outcomes to be able to be the best, right?
Yes.
So with all of your clinical experience, you've gained an incredible amount of clinical wisdom, which I like to call clinical gestalt. So looking back at your distinguished career, is there one lesson that only experience can teach about facial surgery and that every young surgeon should learn as early as possible?
Yes, and here the answer is very short. Every patient, every anatomy, every aging and modification of anatomy is different. This is also the fashion of plastic surgery, because we are not boring with we don't do the same thing all the time, because every patient has its anatomy, and we have to do the best for this difference in aging and anatomy.
Grazie mille, Professor. It's been an absolute pleasure, and thank you so much.
Thank you.